In sub-Saharan Africa, HIV continues to kill around 2,000 people every single day, making it the region's second leading cause of death. Paid sex transactions represent a significant proportion of HIV transmission. The COVID-19 pandemic caused severe economic impact across the globe. Being a high and close contact profession, sex workers are amongst the hardest hit. In order to cope with a potential drop in earnings, a significant proportion of female sex workers may be tempted to engage in unprotected sex, which, while risky, pays up to twice as much. The question is, how has COVID-19 impacted female sex workers and their risky sexual behaviours? This is what a group of researchers at the University College of London, in collaboration with the Ministry of Health of Senegal, investigated in a 2020 study. They conducted a large and in-depth survey of female sex workers in Dakar, Senegal. Approximately 600 female sex workers were surveyed. The results from this survey were then compared with results from data collected in 2015 and 2017. They looked at various metrics, such as sex work earnings, the weekly number of clients, and condom use. Here is what they found. As a result of the COVID-19 pandemic, female sex workers saw a drastic drop in their client number. Compared to 2017 levels, their weekly clientele dropped by 2/3. Consequently, their income also dropped dramatically. The mean monthly income from sex work in 2020 was cut in half when compared to 2017. The data confirms that in order to cope with a drop in income, condom use with their clients has dropped by 17% during the pandemic, and even more drastically, by 27% among asset-poor sex workers. The concern is that if this behavioural change continues, it could lead to a dramatic increase in STIs and HIV transmission. How can this information be used to impact the future of public health?
What we show in this paper is that COVID-19 could have much larger consequences in public health because it may lead to an increase in sexually transmitted infections and HIV.
Now, sex workers are really facing a huge income shock, and what we are worried is that some of them are going into debt, and if they continue to incur deeper debt, whether this economic shock would persist in the longer term even after client numbers improve.
Most of the efforts right now on HIV prevention is really focused on biomedical interventions. However, economic intervention could really be effective HIV prevention strategies. We really recommend any intervention that would potentially help to cope with the effect of economic shocks.